Before we begin, we'd like to thank you all for being such a respectful and great audience yesterday. On behalf of the 2023-2024 IPLE class, we would like to take a moment and thank you all for coming to today's debates. Before we continue on with the debates, we would like to remind all students to be respectful to the candidates and refrain from talking and using your phones and/or any other distractions during the debates. The structure of today's debates will proceed in the following format. We will hear from two debates today. The first will focus on banning sex reassignment surgery before the age of 18. The speakers will be Riley Quirk from the Snow Party and Avery Zatelli from the Safari Party. The second will focus on banning drug and alcoholic abusers from receiving organ donations. The speakers in this debate will be Elizabeth Baxter from the Snow Party and Corinne Basile from the Safari Party. Each speaker will have a total of 7 minutes to speak and answer questions. After each speaker presents their speech, the opposing speaker will have the opportunity to ask one question. After both speakers present their arguments, the audience will be allowed to ask 2 questions. After both debates have been completed, we will open up the floor for questions. Mr. Quirk, you have 7 minutes.
For those of you that were here for this debate yesterday, what I'm about to say might sound familiar. I would like you all to imagine you are 10 years old, sitting in a doctor's office with your parents while you start overhearing a list of words unknown to you. Mydriasis, hyperreflexia, delirium. Your mind draws a blank, but at the very least, you're content with the fact that soon, in spite of all the complex words you have no handle on, the past several months you've agonized over will finally be put to rest. Years pass. You're 14 now, just getting a grapple on your adolescence, when another doctor's visit yields similar confusing phrases. Gastrointestinal bleeding, serotonin syndrome, neuroleptic malignant syndrome, hypomania. All for what? Because you've been feeling a little sad? Because over the past several months you've experienced such severe depression that you can't stand to look at yourself in a mirror, much less function independently? But why should you care? You've been feeling that way for so long. What's one little happy pill gonna do? Not everyone reacts to SSRIs and SSRNs in the same way. You'll probably be fine, just as you were when you received treatment for your ADHD back when you were just 10 years old. Now you're 16. You've been medicated for 6 years of your life and are finally feeling the effects in full force. Improved attention, the ability to concentrate, a greater sense of self-worth. But wait, what's this? It's the state government, and they're not here for your taxes. Oh, now I understand. They just wanted to let you know that they're prohibiting you from continuing on your medication. Why? Because you're a minor. Remember, you're only 16. The risks far outweigh the benefits. But not to worry. This is only an aspect of the Safari Party's reality. A reality where individuals are denied treatment on the simple misconception that they are too young to understand their needs. Though I acknowledge that being medicated and undergoing surgery are 2 distinct phenomena, the fact remains that we can't ban necessary medical procedures because they could be too risky. My name is Riley Quirk, and alongside my campaign manager, Carly Atwell, I am running for state assembly on behalf of the Snow Party. I stand here today hoping to convince you all to maintain the right of trans youth to pursue sex reassignment surgery, and to convince you all of one very simple thing: to maintain what already is. As of now, Executive Order 326 protects the very thing my opponent wishes to get rid of: the assurance that all people, regardless of age, gender identity, or sexual orientation, can pursue all areas that gender-affirming care encompasses, so long as they have parental consent. That includes sex reassignment surgery. Though myself and my opponent offer fundamentally different ideologies, we can at minimum agree on one thing: the mental health epidemic among trans youth is absolutely abhorrent. Rates of suicidal ideation have inflated to an overwhelming 45%. Depression extends its reach to over 50% of the genderqueer population in America, with anxiety finding itself plaguing nearly 80% of people who identify as transgender. But in consideration of these statistics, I need to address one more misconception in Ms. Zatelli's approach to resolving this crisis. She claims that the origin from which trans youth receive such poor mental health is derived from their transition, from societal pressures placed onto them for being non-normative. And while this bears some truth, it completely overlooks the fact that a lack of gender-affirming care is the root cause of this epidemic, not just social pressures. I would like to emphasize the fact that being transgender is not conducive to having depression, but a lack of appropriate care is. Cornell University summarizes this in a series of 18 studies on transgender individuals who had received gender-affirming care, of which sex reassignment surgery is included. Though lengthy, these hundreds of pages of research can be condensed into 5 cohesive conclusions. The first 3 regard one's transition to the other sex as a benefit to their mental health. They state that there is a significant improvement in their well-being and quality of life, accompanied by a marked decline in anxiety, depression, and suicidality. Keep in mind that if it were as Ms. Tatelli claims, where transition amplifies one's mental health issues, the inverse would be true. The fourth addresses regret, and how in actuality, only 0.3% of the transgender community actually experience some form of tangible grief after transition, children included. And the fifth addresses the success of procedures like sex reassignment surgery to be disproportionately high, with social factors being the primary means through which success is avoided. Now, if social factors are the main reason behind gender-affirming care failing, would it not just be redundant to introduce legislation that mandates its partial prohibition? Would this not condemn trans youth to failure? And on the topic of legislation, Executive Order 326 isn't the only piece of governmental jurisdiction that ensures the rights of trans youth. The Supreme Court has enforced several decisions pertaining to parental rights and the role of the government in a child's medical procedures. Washington v. Guxburg, Pierce v. Society of Sisters, Stanley v. Illinois, all of which establish the precedent that parents have, quote, a fundamental right to direct the care, custody, and control of their children. Why then should we allow Ms. Tatelli to encroach on this civil liberty? Why should we deprive parents of their constitutional rights? Why should the government exercise more control over a child than their own parents? It has no place interfering with the medical interests of a family, nor should it have the ability. To allow for such an interference is inherently un-American. I ask that you all consider my platform from a perspective of genuine humanity, where autonomy and safety can coexist. A world where the mental health epidemic among trans youth is not amplified in response to this misguidance. A world where the families of transgender children are not coerced into making decisions that bear no semblance on their actual desires. And so we need to fight to maintain its pristity in any way, shape, or form possible. We have a responsibility to ourselves and to others to ensure that all people, regardless of age, can live freely and authentically, because we can't transition a child who's dead. Thank you, and remember to vote now.
Ms. Tatelli, you may ask your question.
You mentioned in yesterday's debate how there are high depression and suicide rates in trans youth, which the surgery will supposedly alleviate. But aren't we failing to address the root issue of not providing these teens with effective mental health support?
Again, I would like to reiterate the fact that the mental health care you are advocating for is the means to their transition. Gender-affirming care in the form of hormone blockers and sex reassignment surgery like we're talking about today. So with regard to rates of depression and mental health issues, the reason they are experiencing those is because they are unable to transition socially and medically. Thank you.
Ms. Tatelli, you have 7 minutes.
Always look both ways before you cross the street. Safety first. Never walk at night by yourself. Safety first. Put on your seatbelt before you start driving. You guessed it, safety first. We are constantly keeping our safety and well-being in mind every day without even thinking about it. And although we don't realize it, we tend to put our safety first because that ideal has been ingrained in our brains since a very young age. So why does this value not apply to trans youth? According to CNN Health, only 7% of gender reassignment surgeries occur between the ages of 12 and 18. The majority of surgeries, 52% of surgeries, happen between the ages of 19 and 30. Why is this? Because it is safer and more effective to get gender reassignment surgery post-puberty when a person is more developed. So we will make sure to look both ways before crossing a street, but we will also let a child make a life-altering decision at a time that is more dangerous for them. That is far from safety first. My name is Avery Zatelli, and I am running for assembly on behalf of the Safari Party alongside my fantastic campaign manager, Jada Thompson. To begin, I want to clarify that I am in no way against the idea of gender transitions or any kid who would like to transition. However, I am simply trying to allow kids to make an informed and educated decision before they undergo a life-changing and irreversible surgery. The entire process of transitioning is a very lengthy, complex experience. Some begin with the social transition, which can include changing their name or pronouns, while others choose to start with the physical transition, which can include counseling, puberty blockers, and hormonal therapy. The typical end goal for both sides is receiving a gender reassignment surgery, which is very involved. Right now, in the state of New Jersey, any child wishing to receive gender reaffirming care, including hormones, puberty blockers, and the surgery itself, can get it with parental consent. However, a total of 24 states in America have restrictions regarding gender reaffirming care, with some banning all methods of a medical transition for youth. With this ban, kids would still be able to receive puberty blockers and hormones, but they would not be allowed to undergo reassignment surgery before the age of 18. Gender transitions are a long and complicated process, typically taking years for a person to make a full transition. The Endocrine Society, an international medical organization, recommends that hormones should start around the age of 16. Usually after starting hormone replacement therapy, a year or two is needed before receiving gender reassignment surgery. The Endocrine Society recommends that people should wait until the age of 18 to receive this surgery. But with more kids wanting to transition at younger ages, some doctors are doing these procedures earlier on a case-to-case basis. Although I fully understand that kids want to transition to the gender they best align with as soon as possible, that is not realistic or safe. When a person's body is more developed, which is typically after puberty ends, the surgery is way less complicated, since doctors would not have to take growth and puberty into consideration when operating. Not only is physical health a huge factor into gender reassignment surgery, but mental health should be as well. Statistically, depression was reported in 49% of trans feminine youth and 62% of trans masculine youth, which is 4 to 7 times the rate of their cisgender peers. Going through puberty is already an extremely challenging experience for kids, so adding on the pressure of transitioning to the opposite gender can be very overwhelming. My opponent yesterday claimed that the depression and mental health issues found in trans youth will be relieved through surgery. And while surgery may solve the internal conflicts trans youth experience, it now opens up a whole world of external dilemmas. As much as society has progressed and are working towards having more worldly perspectives, we are still judgmental creatures at heart. For example, if I decided to transition to a male and I started to use a male-assigned bathroom, people may feel uncomfortable with my presence in that bathroom. So unfortunately, and although I wish it was different, there are now an abundance of challenges to overcome regarding in social settings such as sports, school, and daily life as a whole. Maybe instead of allowing kids to undergo such an intense procedure, we should be focusing on getting these children the support system they need to transition smoothly. Mental health is a serious concern among trans youth, but another huge consideration about receiving gender reassignment surgery at a young age is the fact that it is considered to be irreversible. A child's brain is not fully developed, yet we are still allowing them to make a decision that can change the rest of their life. Yes, they are made aware of the potential complications that can arise from this procedure. However, they're not going to fully comprehend what these risks actually entail. Risks like necrosis of the vagina, urethral stenosis, and loss of erotic sensation. I'm 18 and I still have no idea what any of those complications include, so I can't imagine if I was 8 or 10 or even 12. Kids are still trying to figure out their identities and understand their gender, so shouldn't they wait until they are fully developed and educated in order to make that decision themselves? In the US, people cannot get a tattoo, vote, serve in the military, or buy spray paint until they are the age of 18. Yet we are allowing children to go through a surgery that is extensive and permanent as early as the age of 8. So next time you need to cross the street or start your car, imagine if you never took the precautionary actions you once did, like checking both ways or buckling your seatbelt. Even if you don't get hit by a car or don't get into an accident that time, why take the chance in case it happens the next? Why are we letting trans youth take that same risk on their bodies? That's not very safety first of us.
Mr. Quirk, you may ask your question.
Why do you believe the government has any place interfering with the decisions of families when conditions the child are exposed to are not abusive, nor are they harmful to their well-being?
Thank you for your question. I think that's on the same basis of why the government sets age limits for things like driving, drinking alcohol, voting, serving in the military, or even making medical decisions for themselves. None of those things that I just mentioned are necessarily abusive or harmful, but they do this because it is safer for the well-being of kids. And also, this surgery is not the result of a health risk. Therefore, the government has every right to restrict it. Thank you for your question.
Next, we're going to take 2 questions from the audience.
My question is for the snow party. Isn't getting a gender reassignment surgery the same as using drugs to cope with internal problems, i.e. the lack of identity that is not based on reality caused the depression? My connection is that a drug abuser is most likely unhappy and relies on drugs for their happiness.
I think to compare a transgender person's struggle with gender dysphoria to someone who abuses drugs is beyond the reality of the situation. A transgender person is receiving this care not because they are addicted to something. They're receiving this care because they are mentally predisposed to this condition, because they are medically predisposed to not being comfortable in their own body. Thank you.
I have a question for the snow party. According to the National Institute of Mental Health, you are not fully mentally grown until the age of 25. So why are we trusting young children who won't eat their vegetables because they don't taste good, be mature enough to make permanent decisions that will change their gender? And how do we know that a young child won't regret this decision in the future and be unable to reverse it? This goes double for kids who haven't transitioned to puberty yet and will not be able to freeze sperm or eggs in case they want a biological child in the future.
As I mentioned in my speech today, 0.3% of the trans community experiences regret post-transition. But to address their ability to make decisions at their age, I also addressed this yesterday. We have to consider the fact that a child's personality and identity are not the same thing. They're facets of each other, but a distinction needs to be made. Their personality is expected to change and to be born anew over the course of their childhood, whereas their identity is fully developed by the age of 5 or 7. So they are fully capable of making decisions regarding their gender at that age. Thank you very much.
We're going to invite the next speakers up to the stage.
I'm not starting.
I think so. That's what Gallo told me. That's what Gallo told me.
Okay, I'll start.
Ms. Baxter, you have 7 minutes.
You get a heart, you get a kidney, and for you, I'm gonna give you a pair of lungs. But wait, that's not how this works. Just like my opponent said, I am not Oprah Winfrey. And just for the record, neither is the Organ Procurement and Transplantation Network. Hello, my name is Elizabeth Baxter, and alongside my campaign manager, Porva Munjal, I am running for the House of Representatives with the Snow Party. I didn't want to focus too much on the science of genes or transplantation. It can get a little boring. But based on the last 2 debates, it appears that I must. There are 3 factors that are tested to even begin the search for a match: blood typing, cross-matching, and HLA testing. Blood typing is self-explanatory. An O negative is a universal donor, and an AB negative is a universal recipient. Cross-matching is done just before surgery. It's when the donor and the recipient's blood is mixed to test if they're a good match. Cross-matching increases the chance of organ survival by more than 15%. HLA, or tissue testing, looks at the body's antigens. 6 antigens affect the transplant survival. Except in cases of identical twins and some siblings, it is almost impossible to get a 6 antigen match between 2 people, which is why it is so difficult to match an organ and a recipient. When an organ becomes available, UNOS, the nonprofit organization that oversees the transplant system, has a lot of factors to consider. Of course, they need to find as close of a genetic match as possible, but they also have to consider distance. I'd love to go to the beach. I go all the time, obviously. But guess what, guys? It takes about 2 hours to get to Wildwood, and we live in one of the smallest US states. Just like my opponent says, major organs can only last 6 hours outside of the body. During those 6 hours, UNOS has to find a match, set up a transplant team, and transport the organ. Now, my opponent has taken this to mean that alcoholics can get in the way of this. She says that by taking everyone, we are saving no one. But I want you to all sit and think about that. How can expanding the probability of a genetic match in a certain region hurt the transplant system? By keeping the pool open to everyone who needs an organ transplant, there is a higher chance that a match can be made in the same region or DSA as the donor. Nearby matches are the difference between life and death. Studies show that the faster that the organ is transplanted, the higher the success rate of the transplant. Alcoholics are not a waste of organs, but rather they provide a new life. And to go further onto this point, alcoholics are by no means taking an organ away from a more deserving adult. The system that determines who receives an organ looks at many factors, and their lifestyle is one of them. Alcoholics and addicts go through something called deprioritization. This is when the hospital moves an alcoholic to be below a non-alcoholic. While I may not agree with the moral implications of this system, it is still a common practice, and with this method, there is an extremely low chance that an alcoholic will take a viable organ from someone else. If an alcoholic receives an organ transplant, it is because they are closest and the ideal match, giving them the highest chance of survival. Moving on, my opponent did not just mischaracterize the transplant system, but she also mischaracterized addiction. According to her, addiction permanently alters the brain, making them unfavorable candidates for transplantation. While I do not dispute the fact that addiction can change certain aspects of brain chemistry, there is no evidence that this affects transplantation or recovery. There were no differences between the survival rates of an addict and a non-addict. The statistic that 1/3 of all transplants ends in death was thrown around a lot, but that number is not inflated by addicts. The truth is that rejection is common among both addicts and non-addicts. We don't necessarily know the cause, but we do know that there are genetic and environmental factors that can influence this. The main concern that we can control is how the patient treats the organ after transplantation. It was implied that because the altered brain chemistry, an addict is unable to stick to a medical regime that they will continue to drink and indulge. A study by the National Institute of Health found that between 6 months and 3 years after transplant operations, a small 9% of an unusual punishment. While Ms. Basile claims that she is not punishing addicts for their choices, punishment is the imposition of an unpleasant outcome upon a group or individual as a response or deterrent to a particular behavior that is deemed undesirable. As per Ms. Basile's argument, addiction is undesirable, and thus we must take away life-saving medical care. That sounds an awful lot like punishment, meaning that it does actually break your 9th Amendment right. The 14th Amendment protects against discrimination. To this, Ms. Basile claimed that it was not a person's right to demand an organ. Ms. Basile, you are correct. It is not my right to take another person's organ. However, under the Uniform Anatomical Gift Act of 1968, organs were declared a gift which you may direct or simply give to science. By giving up your organ, it becomes a tool to assist doctors in saving lives. It is in fact your right to demand that doctors use the most effective and reliable treatment, which for organ failure is transplantation. Doctors cannot deny care to a patient based on any discriminatory factor, including their genetic predisposition to addiction. And so it would actually break your 14th Amendment right. I don't know about you guys, but this platform is sounding very unconstitutional and very un-American. Yesterday, Ms. Basile compared the U.S. Transplant Network to a basketball team in which we are forced to make cuts. While I can understand her sentiment, it is disgraceful to compare a high school team in which being cut might at worst mean you have to study in your free time to a life-saving system in which a cut would mean death. My opponent claims that there are various alternatives to transplantation. She specifically brought up dialysis, which can prolong life.
Please finish your thought.
Then I'm done. Yay! Whoops.
Ms. Basile, you may ask your question.
Although the effects of neuroplasticity are able to integrate an addict back into society, how do you justify that people with irreversible cognitive damage are as qualified to maintain post-operational care as those who have never suffered from an addiction with this shortage?
Thank you for your question. Neuroplasticity is the ability for the brain to change over time. So while it can change when you first undergo addiction, and it can change some chemicals that lead to withdrawal symptoms, the actual effects, the chemical changes in the brain, don't have to do with your ability to take medication. It doesn't change, in most cases, your memory or your ability to remember. And so they will still be able to function at the same level, especially if they get the proper care and treatment that addicts and alcoholics are offered and put in the time and effort. And so they will be able to come back from any type of changes that you suggest would affect their ability to respond. Thank you.
Ms. Basile, you have 7 minutes.
How many people here like card games? Blackjack, solitaire, maybe some spoons? I know I'm always down for a game of Go Fish. But the best part about these games is that they don't require a lot of skill. It's all luck of the draw, similar to our current transplant selection process. Funny enough, you have the same probability of drawing the 7 hearts on your first try that patients on the transplant list have of actually receiving an organ. 1 out of 52 doesn't seem too bad sitting on the couch laughing with your friends. But when it's a matter of life and death, suddenly there's enough playing around. Hi, my name is Corinne Basile, and I'm running for the House of Representatives on behalf of the Safari Party alongside my superb campaign manager, Bridget Duffy. Picture yourself walking in the woods, minding your own business. Then all of a sudden, you encounter a bear. This is a super dangerous situation. So how do you go about solving it? Close your eyes. That's all you need to do. Because if you can't see the bear, then it's not your problem. Unfortunately, the bear can still see you and is still very hungry. And this actually solved nothing. What I just described to you, ladies and gentlemen, is called ignoring the problem and hoping it goes away. A technique my opponent, Ms. Baxter, has mastered during these debates. When dealing with a situation that determines the lives of thousands, it is easier to pretend there's nothing wrong than to tackle the problem from the source. And when I say the source, I literally mean the source. The Community Ethics Committee is a source established to decide who is deemed fit to receive an organ transplant. Now, Ms. Baxter has attempted to argue time and time again that this debate comes down to moral values. But following this logic, where is this conscience for the people who are currently excluded from the list? Do their lives not matter? It's hypocritical and blatantly ignorant to classify this restriction as inhumane when this approach is really happening with other factors like age, multi-organ failure, and even weight. It makes no sense to point fingers in my direction for a practical solution that is already implemented. Another thing I would like to clear up with you all is the premises of addiction and what it really means to be an addict. The word addiction has been floating around Ms. Baxter's speeches like a kite in the wind. She seems to be confused on the difference between social drinking and truly suffering with an addiction. Between the mentions of drinking culture in the US to then say addiction is a genetic disease, I don't know about you, but my head is spinning with all of these contradictions. Yes, there is a big alcohol and smoking culture across America, with 68% admitting to drinking and 22% to smoking. But the majority of these people participating are not addicts. Even of the 16.7% of Americans that do suffer from a substance-based addiction. The majority of this population will not need an organ donation anyways. The only people who are even referred to the transplant list are those who are critically ill and in the end stages of organ failure. So having a martini on the beach or sharing a drink with your boss is nowhere in the same ballpark as a diagnosed addiction. Ms. Baxter also brought up the point that the organ an addict needs may not be a consequence of the addiction itself. But I guess she may not have been listening to my first couple of speeches. This is not a punishment for addicts for their addiction. Rather, this decision is based that the unpredictable circumstance after the transplant. So it makes no difference what specific organ is needed or why, because they all follow the same complicated aftercare procedure that is potentially difficult for an addict to maintain. Old, young, tall, short, addict, no history of addiction, it doesn't matter. If you put somebody else's body part in your body, your brain will detect something is wrong. This is rejection, which is preventable by tricking the brain through a regimented schedule and abundance of prescription medications. Again, nothing to do with addicts personally. I acknowledge that it is difficult to find an organ match, as Ms. Baxter has also explained, but it's not as rare as she makes it seem. The most difficult organ to match with is a kidney, as it follows its own additional criteria, like donor-recipient immune system compatibility and height. But the main reason for this overpopulated list with excessive wait times is because of the vast supply and demand chain, according to Northwell Health. There are just too many people that we cannot possibly help them all. This is why it's extremely important to make sure the organ has the best chance of survival post-operation, because it isn't like we have any extras in the back. Yesterday, there was a question regarding the effects of neuroplasticity and how it aids in sobriety. And although it does play a huge factor in recovering from the dependence, the brain will never fully revert. There are recovered and functioning addicts that live and interact within our societies the same way we do, because their neuroplasticity has aided in their cognitive rehabilitation. That being said, the brain is never able to completely return back to its original state. So even though a person could be sober for my entire 18-year lifespan, their aversive mental pathways will never be the same. Thus, why they are not as qualified as better candidates as non-addicts. It is time to focus on the greater good and to clean up a system that has blown way out of proportion. As medical advances improve and more resources become available, this dramatic 60,000 person gap will gradually start to close. This is a difficult topic to approach, but I am taking a stand for the greater good and preparing the United States for long-term benefits by restricting this eligibility criteria. This is a topic that will never affect the majority of people in this room, and it's super easy to turn a blind eye to. But I urge you, as the American people, to stand for your fellow and future citizens who never forget to tell their loved ones goodnight, because for them, tomorrow is never a guarantee. No matter how badly you want it to go away, the bear is still behind you. As Mark Twain once said, the truth hurts but silence kills. So open your eyes, vote for me, and in favor of the Safari Party to finally see a change for a brighter future. Thank you.
Ms. Baxter, you may ask your question.
In many cases, an addict or alcoholic is able to reach sobriety without having to report their addiction. If there is no documented evidence of an addict, how will you ensure that they remain barred from the transplant list?
Unfortunately, that's part of it. Things go undocumented all the time in the United States. If there is no documentation, we cannot accuse people of having an addiction, even if there is relevant evidence. We have to go based on medical forum, and that's all. Thank you.
We're going to have two questions from the audience.
Thank you for your question. So, we have to eliminate all addicts from, no matter the distance or length of their sobriety, because to reduce this criteria, we have to generalize, which I know it sucks, but we wouldn't really be reducing the criteria if we add more factors. So by eliminating addicts as a whole with 18 years sobriety, 6 months sobriety, it makes it more concise, it makes it easier. So unfortunately, no, they will not be considered.
Like if your family member, sorry, the question is for Safari. If your family member or your friend was like an addict and they needed like an organ transplant, would you still stand by your argument?
Thank you for your question. Yes, I would.
All right, we're going to invite all speakers up to the stage, and we're going to open the floor for questions. And the campaign managers.
The floor is open for questions.
Yeah, no, I brought it up yesterday. Would I say my argument?
This question is for Corinne. If alcoholics and non-alcoholics have the same chance of survival after organ transplant, why should we value one life more than another? Are you saying that alcoholics are less deserving of survival because of their genetically predisposed disorder?
Whoa, that's quick. Yes, thank you for your question. So we've gone over this a couple days. This isn't about who's deserving, nor is it really a moral argument. We're hurting everybody by accepting everybody. So in order to reduce the criteria and make this actually available for the 60,000 people that will never receive an organ, we have to generalize. It's not that they deserve the organ more or less. It's just the fact that they have cognitive damage that people that have never suffered from addiction don't, which means we're just trying to put our best foot forward in receiving the best candidates. Thank you.
I have a question for Avery. You say that your debate regards safety. Would you say that suicidal ideations are more safe than just a surgery?
That's a great question, and like I mentioned in my argument, the depression continues after the surgery, and depression leads to suicidal thoughts. So obviously, no, I do not prioritize suicide over this surgery, but I'm simply trying to make it safer, more physically for their bodies, because again, once you are an older age, it is so much easier to transition through this process. So obviously, socially, the depression would still continue post-transition in just social settings in general, like I mentioned in my speech before. So obviously, the depression and the suicide rates are not just going to decrease after the surgery. Thank you for your question.
This is for the snow party, Riley. This is for Riley. When you become 18, you make your own decisions on your health unless you give up those rights. So how do you plan on safeguarding children under 18 from their own parents if they choose to push their kids into gender reassignment surgery?
I think this is a very common misconception that parents are forcing certain ideologies onto their children. Parents don't force being transgender onto their child. The child takes it upon themselves to pursue sex reassignment surgery, though they do need parental consent. The real problem arises when that parental consent or those parental ideologies don't align with the identity of the child. Thank you for your question.
We have time for one more question.
This is for the Safari Party on transplants. Like you said that by restricting alcoholics from the list, it's that the 60,000 people who couldn't get an organ and it would be reduced. But that doesn't sound like it would be because more people are getting organs. That just sounds like you're ignoring a solid chunk of that 60,000.
What was the last part of that question? I'm sorry.
By cutting alcoholics from the list, that doesn't sound like more people are getting an organ. It just sounds like you're you're ignoring a solid chunk of the people who can't get an organ. Like you're just ignoring the alcoholics. Like their list isn't reducing because like more people are getting an organ.
That's not a question.
All right, guys, thank you for coming today. Voting starts Monday. We're moving to block 3.